Is bruxism the same as TMD? What harm does bruxism cause? What are the Gorman Center's treatment options for bruxism? Okay, so bruxism just means grinding of the teeth. Okay, TMD is a whole category of things called temporomandibular dysfunction. Bruxism is a symptom potentially of a TMD. Bruxism, the issues with bruxism is because of a lot of grinding, it can wear teeth. There can be a lot of wear on the teeth of natural teeth. It can wear or break or fracture dentistry. If you've got porcelain dentistry against natural teeth and there's a lot of bruxism going on, it can cause an increased amount of wear, especially on the natural teeth. It also can have an effect on the muscles because the muscles are what drive the bruxism, and if the muscles are working all the time, so at times when muscles should be relaxing, like sleep, they may be overworking, and that can lead to headaches and other issues within the joint. Our treatment options for bruxism is to try to determine what is the source of the bruxism. Is it because of a bite issue that needs to be adjusted? Is it due to sleep issues, upper airway issues, sleep apnea issues? All of those things we try to determine, and especially when we're working up a case for a patient who's interested in doing any kind of major restorative dentistry or any cosmetic dentistry that involves several teeth, especially teeth that are involved in guiding the bite during function, then we want to know where that's coming from. And a lot of times, the simplest thing that we could do is make a night guard for people, just so that they have a piece of plastic between their upper or lower teeth, so that if they're going to grind, they're not going to grind tooth to tooth. They're going to grind on a piece of plastic. And if something is going to wear, it's going to be the appliance instead of their teeth. A lot of times when patients have a history of that and we've worked them through appliance like that and they've stopped grinding, or they're not grinding to the level they were before and they're comfortable, and we can go ahead and do the restorative dentistry that we need to do for them, then we will follow up and give them a night guard afterwards to protect the dentistry that's in there, as a safety precaution, as an insurance policy for the time and the investment that they've put in. And most people get really comfortable with that, and almost to the point of being very uncomfortable if they don't have their appliance at night. I've had patients, leave them in hotel rooms and things like that, and they can't wait to get in and get a new one because they're just so comfortable with it and they've gotten used to it.